name is Dr. Paige E Davis, and I work as a senior lecturer in developmental psychology at York St. John University. I thought it would be nice today to talk about how COVID-19 impacts upon my research, which is looking at children and how they create imaginary friends. So when we see imaginary friends in children, you'll see them from about age 4, but it can be lower, and you see them kind of tail off at age 7. When you look at populations, about 30 to 50% of the population children will create imaginary friends. So my thinking is that now that we're all under quarantine and our children are under quarantine, we're going to see a lot more imaginary friends being made. And the reason for this is because children make imaginary friends when they need a social partner. Now, they might have a brother or a sister, but they're getting way less social interaction than they would at school when they're running around doing all the social things that they do. Their brains, though, are very good at protecting them against this lack of social interaction. They make up their own imaginary friend then. And so this social interaction is done with the friend. Parents might think, is this an issue? My kid's making up an imaginary friend. They've never done this before. Well, fear not, parents. Just know that kids that do make up an imaginary friend are better at social and emotional understanding, and they're better at putting themselves into other people's shoes. So it's a really good thing in the long run. It's just a little bit of a silver lining if your child does make an imaginary friend in quarantine.